Senate Committee on Emerging Issues is being called to order. I should call the roll.
Senators Brown,
Here.
Moon, Gannon,
Here.
Koenig, McCreary, Shore, Beck. We have a quorum.
We have a quorum. We're hearing one House bill today. Representative Peters, whenever you're ready.
Good morning, Mr. Chairman, members of the committee. For the record, Representative Tara Peters from District 122. I represent Phelps County, Rolla, Missouri, St. James, Missouri, hometown to Chairman Justin Brown, MS, best town in the state, home to MS&T, one of the greatest engineering schools in the state, and we have some great wine at St. James Wineries as well. So I'm here to present this morning to you House Bill 2413. This is about prioritizing the health and well-being of Missouri women and Missouri babies. This bill does five very important things in my mind. Number one, it updates the current statute that is regarding mammogram notices. So currently, if you go to get a mammogram, the radiologist will read the federal statute and not the state. So we just want to do away with some language of that to make it easier for that process. Number two, it requires additional screening. Disease screening for consenting pregnant mothers at 28 weeks, and this will address the spikes in Missouri's congenital diseases that are preventable with early treatment. Number three, it allows women with private health insurance the option of getting their contraception a year supply at a time. This will therefore increase the continuity of use. It will reduce unintended pregnancies by over 40%. The fourth thing it does is it updates a statute dealing with EPT. For those that don't know what that is, it's expedited partner therapy, and this will allow additionally sexually transmitted infections while allowing providers with prescribing authority to be able to practice the EPT. And this in turn will help reduce the rising STI rates because STIs increase transmission and therefore have adverse health outcomes. Finally, House Bill 2413 removes specialty hospitals from forensic exam requirements as long as they have a transfer policy in place with an appropriate hospital. So what this does is this language was actually never meant to be included in that, and the hospitals that were required to do that were not properly equipped. So again, it's just some language changes to take care of that forensic exam requirements for hospitals. So that is basically what this bill does, and I can take any questions.
Thank you for your testimony. Any questions for Representative Peters? Senator Mint.
Good morning, Representative Peters.
Good morning.
We had the pleasure of meeting last night, so that was good that you're here today too. Can you tell me, in the original bill you had with regarding to mammograms, is that correct?
Yes.
And I'm going to be a little persnickety here probably, but it's just something that I've a practice that I've tried to stay close to from my time here in the legislature. The bill's purpose was changed, is that correct?
That specific bill, there were 5 bills that were combined into one. So are you asking about that specific bill?
Well, no, I'm asking about the original purpose had to do with mammography, and so that was the original purpose. Am I off base there?
Well, my understanding is, so that we had slots over in the House this year. So in order to do that, we had 5 separate bills that were combined together to make 2413.
Did you introduce a bill?
The mammogram bill?
Was that, okay, you introduced the mammography bill?
Yes.
Okay, so that was the original bill you had introduced.
That and the extended supply.
Okay, and so then in committee, is that where the change came to add the other elements?
Yes.
Okay, and so in committee, they changed the purpose from mammography to relating to health care. Is that right?
That is correct.
Okay, good. So because of that, and again, that's where I'm trying to hold a pretty firm line. When it comes up for vote, I'll probably not vote for it. I would, for most of these things, I'd probably support, but because they've been cobbled together in such a way that I believe Article 3 may have been compromised, I'll probably be against, but.
Understandable. I think our hands were a little tied, to be truthfully honest. Again,
Yeah.
we only had so many slots, and trying to get great legislation
Yeah.
passed, we had to kind of combine it together in order
Right.
to do that.
Understand.
Thank you.
You're welcome.
Any other questions for Representative Peters? All right. Thank you. First witness testify in favor of the bill whenever you're ready.
Thank you, Mr. Chairman, members of the committee. Garrett Webb, registered lobbyist for the Missouri chapter of the American Academy of Pediatrics. Congratulations on your first bill in a Senate committee. We support many of the provisions of the bill. We believe healthy moms lead to healthy babies, lead to healthy kids. So we specifically support the updated blood testing protocol. As the representative mentioned, we have seen a huge spike in the numbers of instances of STIs that are occurring in newborns. We believe that specifically with hepatitis C and HIV being added to the screening and the second screening, that the earlier we can begin a treatment protocol for both the mother and for the baby, the better the outcome will be for both, or perhaps more than two lives if in the instance of twins or triplets or others. So we really support that provision in addition to many of the other provisions within the bill that protect the health of mothers and babies.
Thank you. Any other question for witness? All right, thank you. Next witness testify in favor of the bill whenever you're ready. I'll remind the witnesses to leave a witness form so your testimony be made into public record.
Good morning, Katie Gamble here on behalf of the Missouri Center for Public Health Excellence. Want to go on record specifically on the blood testing portion of the bill. It passed out of Senate committee. Senator Gannon carries the companion bill over here, and it passed out of that the Health Committee unanimously. We've seen a huge spike in congenital syphilis from around 8 cases to around 50 some, and when it's a treatable disease, we want to make sure that those numbers are going lower and not higher. And then also testifying here in support on behalf of the American College of Obstetricians and Gynecologists Missouri chapter in support of both the blood testing piece and the year's supply of hormonal contraceptives.
All right, thank you. Any questions for witness? All right, seeing none. Next witness testify in favor of the bill.
Mr. Chairman, members of the committee, my name is Kaina Iman on behalf of the Missouri Nurses Association. We appreciate the sponsor and their co-sponsors behind me that are bringing this bill together. It was a lot of work in the House to get it through committee. We made a lot of progress in working with people on both sides of the aisle, and we just think it's a great piece of legislation on behalf of women's health.
Thank you. Any questions for witness? All right, seeing none. Next witness testify in favor of the bill.
Thank you, Mr. Chairman. Jeff Howell with the Missouri State Medical Association. Just want to go on record
All right, thank you.
record in favor of the bill, specifically expedited partner therapy and prenatal testing.
Any questions for the witness? Seeing none, next witness testify in favor of.
Heidi Lucas, Missouri Rural Health Association. I'm the executive director, and we are here in support of the entire bill. However, particularly the annual supply for birth control and expedited partner therapy. Such an issue in rural communities, transportation, and other barriers to care to be able to get to their prescriptions in a timely manner, which is the annual supply of birth control would certainly alleviate. Same issues, again, with the expedited partner therapy when one partner gets it, and then the other partner can just get their issues taken care of at the same time. Saves time, allows folks to have child care issues taken care of, those sorts of things. So very much in support of the bill. Thank you.
Thank you for your testimony. Are there any questions for the witness? All right, seeing none, next witness testify in favor of the bill. Whenever you're ready. Waiting on you, Megan.
I'm coming.
No, don't rush.
Thank you, Mr. Chairman and members of the committee. My name is Megan Travis Henderson on behalf of the Missouri Hospital Association. I'm here to speak specifically related to the SANE examinations and carving out certain specialty hospitals. There's about 25 hospitals in Missouri that would impact. In 2020, legislation was passed that required sexual assault nurse examinations for any victim who showed up in an emergency department in a Missouri hospital. What wasn't contemplated in that situation was hospitals that don't have standalone ED EDs. So if you think about an ED on TV, they don't have something like that, right? It's a psychiatric hospital, it's a rehabilitation hospital or long-term acute care. So what this does is it just carves those hospitals out as long as they have a transfer agreement. So if a victim were to find themselves somewhere that does not have an ED, they have to be immediately transferred to somewhere that would be able to provide that appropriate care. Happy to take any questions.
All right. Any questions for the witness? All right, seeing none, thank you for your testimony. Next witness testifying in favor of the bill.
Running as fast as I can.
Now, hurry.
Thank you, Mr. Chairman, members of the committee. Tricia Workman here today on behalf of the Missouri Coalition Against Domestic and Sexual Violence. Thank the sponsor and co-sponsors for their hard work on this. I ditto what Megan said, and Senator McCurry has carried that legislation in the Senate, so we support the whole bill and specifically the exemption for specialty hospitals.
Well, thank you for your testimony. Any questions for the witness? All right, seeing none, next witness testify in favor of the bill.
Thank you, Mr. Chair, members of the committee. My name is Mandy Hankseth. I'm the Director of Policy and External Affairs for Missouri Family Health Council. Missouri Family Health Council for over 40 years has administered the Missouri Title X Federal Family Planning Program. We also administer the state-based contraceptive equity initiative called The Right Time, which is funded by Missouri Foundation for Health. We serve 40,000 Missourians every year, specifically speaking to the components of the bill that are the annual supply contraception and the expedited partner therapy. I think everybody before me has summed up all of the universally supported elements of this bill. So I would just leave you with a couple of additional notes. I suspect that you're going to hear some opposition from our friends in the insurance industry, and I would note that annual supply contraception is law in 25, technically 26 states. An additional state just passed the law as well. And those states, after rigorous analysis, determined that the benefits are far more compelling than the claims by the opponents. Additionally, I want us not to forget that the insurance industry did not voluntarily choose to cover several aspects of women's health care, including pregnancy, contraception, and reasonable hospital stays after giving birth and after mastectomies. I'm happy to answer additional questions on those two provisions of the bill, but we are greatly appreciative of the sponsors, especially coming to the committee today, and thank you for your time.
All right, thank you for your testimony. Any questions for the witness? All right, seeing none, next witness testify in favor of the bill.
Mr. Chairman, members of the committee, Chase Campbell, just going on record in support for Children's Trust Fund, National Association of Social Workers, and BJC Children's Hospital, in particular the prenatal blood testing portion.
All right, thank you for your testimony. Any questions for witness? All right, seeing none, next witness testify in favor of the bill. Are there any witnesses to testify in opposition to the bill? Whenever you're ready.
Thank you, Mr. Chairman. Shannon Cooper today representing America's Health Insurance Plans as well as Blue Cross and Blue Shield of Kansas City. Yes, I'm the bad guy. 4 of the 5 provisions of this bill are great. I'm here today to speak against Section 376.1240, which is the year's supply of birth control. There is no other maintenance drug in this state that we allow to be delivered in a 1-year supply. So it's not that I'm against the birth control. I'm against the policy that now, what will it be next year? Will it be my blood pressure medicine that I ought to be entitled to for a year's supply? And the fact is, the majority of our commercial members are month-by-month payers. So we bristle at the argument that, hey, I could be on in January, get a year's supply, and cancel my plan February 1st, and then as a health plan, I have provided a year's supply to somebody who is no longer a member. I'd also like to point out that under the ACA, we provide those as part of that plan, but we provide them for members. The arguments that it's just too difficult to travel or go to a pharmacy has been alleviated by mail order. You can get a 90-day supply delivered to your home. So if you think that the burden to go to the pharmacy is too great, rest assured that there are options to have those pharmaceuticals delivered directly to your home. With that, Mr. Chairman, I'd be happy to answer any questions.
Thank you for your testimony. Any questions for the witness? All right, seeing none.
Thank you.
Are any other witnesses testify in opposition?
Mr. Chair, members of the committee, Michael Henderson for the Missouri Insurance Coalition, opposed to the section on the one-year contraceptive for the same reasons Mr. Cooper outlined. Happy to answer any questions.
Any questions for the witness? All right, seeing none.
Thank
Any
you.
other witnesses testify in opposition to? Any witnesses to testify for informational purposes only? This really means they're against it, but they don't want to go on record to be against it.
I'd like to go on record that this is informational. My name is Ben Terrell. I'm the Legislative Director for the Department of Health and Senior Services. I just wanted to go on informational and explain the underlying portion of this bill. The mammography piece was a department proposal. There is a new federal standard coming out for how these mammography reports are done. The state standard was good while we had it, but now that there's an overriding federal standard, it just proves to cause confusion. So just trying to reduce some of that. That's all I got.
All right, thank you for your testimony. Any questions? Senator McCreary.
Could you talk a little bit about, so when somebody gets a mammogram, then there's follow-up that happens. Can you talk a little bit about the confusion that happens then with that follow-up?
Right. If there are two standards for how that follow-up occurs, the provider is supposed to follow the federal standard, but if there's also another state standard, it can be
Right.
confusing which one they adhere to. The state standard is just a template paragraph, but the federal standard is more flexible. It involves different categories about what is found. And so how is that put together, I think, can cause some confusion. So this is just trying to clear all of that up.
I appreciate that. I think people are already on pins and needles sometimes after they get a mammogram, and so some of the language that's used in that template can cause undue concern and alarm. I think it's just a really good cleanup language, quite honestly.
Yeah, and whichever senator's carrying that is doing a great job. She's fantastic.
Thank you.
Same for that representative.
Any other questions for a witness? All right, seeing none. Any other witnesses testify for informational purposes only? All right, well, Representative, it's a great bill. I'm looking forward, I'm going to go against everything that I normally do in this committee, and we will have an executive session on this Thursday because Senator Gannon's carrying it. But I'm proud to support this bill. I think it's wonderful. I think it does a lot of great things. Do you have any closing comments?
I do not. I just thank you guys for listening. I do think it's an important bill as well, and I appreciate you guys prioritizing women and babies' health here in the state of Missouri.
All right, thank you. With no further business coming for the committee, I make a motion to adjourn. Do I have a second? I have a second. We're adjourned.